Hey, everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Education and Partnerships at SICA, where we partner with healthcare professionals and clinicians to offer body composition solutions. I'm so excited to be joined by Anna Gordon, who's a mind body eating coach at Health Psychology Partners, and she gets to work with one of my favorite colleagues and friends, Robin Pashby. And so she connected us so that we could have this conversation today about weighing and psychology and behavior, motivation, and all sorts of things. I'm really excited to talk to you, Anna.
Me too. Thank you for having me.
So what I really wanted to kind of get into first before we deep dive into some of those other topics is a little bit more about health coaching and your role within a practice. So I know Robin has been in the obesity care community for a long time. She and I are on the board of the Obesity Action Coalition together. So I know a lot about her practice and her thoughts on comprehensive care models and all of that. So I'd love for you to maybe share your role on that team, and then a little bit more about health coaching because it's come a long way in the past several years from when I first learned about it, which was in fact after I got a PhD in psychology. And I feel now that the coaching is such a more robust program than it used to be. So let me know kind of your thoughts about that and your role.
Yeah. Yeah, sure. So I am a health coach. I call myself a mind body eating coach. It's one of my certifications. And what that means is that I work with people to support them in creating a peaceful relationship with food. So the work that I do and the work that Dr. Pashby do are more alike than they are different, but obviously the distinctions are very important. Coaching is sort of similar to therapy. The purpose of coaching is to increase awareness and choices. And we do that by engaging in kind of this purposeful conversation and then taking action and having accountability in between sessions. So, very similar to therapy. The differences are really around complexity. So, you can work with a mind body eating coach and with a therapist on similar issues. So, for example, if you are like overeating a lot at night and feeling really out of control about that, that's something that you could probably work with either a therapist or a coach on, and really making that choice about which one you want to work with has to do with like how complex kind of the other factors are. So like if you are healing from a traumatic event, or you are also dealing with other mental health challenges like depression, or you have a really complex health history, then that might be a sign that you want to work with a therapist. But if you don't have those additional challenges, you'd probably be equally well served by working with a coach. So I'm there really just kind of to support her practice and to help it, Health Psychology Partners be able to reach a broader range of people. Coaching it's more affordable than therapy, which is helpful for a lot of people. And it also tends to be a little bit more focused on action and accountability and kind of forward looking, which can be helpful for people who are really like have goals that they want to achieve and are really looking to focus on moving forward, as opposed to like spending most of their time really healing and grappling with the past.
I love that.
Yeah.
Great.
Should I tell you a little bit more about kind of the coaching that I do, or is that
Tell
enough?
me. Yes, I'm very interested in hearing that. Thank you.
Okay. I just want to make sure I make it clear. So I work with people on creating a peaceful relationship with food. So the clients that work with me usually come to me feeling like food is playing an outsized role in their life. So they are thinking about it all the time. It is really like what dictates their mood. It dictates how they feel about themselves, how they feel about their day, how they feel about their relationships, etc. It's really just kind of like playing a big role in their life, and usually not in a supportive way, but in a kind of like critical, torturous way. And the thesis behind the work that I do is that these kinds of challenges and the challenges that go around along with, food having a big role in your life. So challenges like overeating or binge eating or chronic dieting or emotional eating. These challenges, in my view, aren't really just about the food. And in order to get relief from these challenges, we can look at food and diet, but we also really need to realize that like finding the perfect diet or finding the perfect exercise regime isn't really what these challenges are asking us to do. Part of the reason that they're here is to encourage us to look kind of below the surface of the food related challenges to understand like what are the beliefs, what are the emotions, what are the stories that are driving those behaviors, and make sure we're working on that stuff as well as like the diet and exercise. Makes sense.
Mm. I already love all of your language. It's really in line with how I think, most practitioners need to be talking about all of this. So that is amazing. I think one of the things that when we started talking that we had shared interest in, I know you have a lot of experience with, is to kind of unpack a little bit about patients or people's relationships with the scale and how that shows up in those stories, beliefs, and thoughts that they have around themselves and, their ability to make change. So, and as you know, I work for a company that makes scales, right? So we, that has been our bread and butter for almost 200 years. But we've been in the body composition space for about 15 now, maybe about 20 years now. And so it's a different angle. So we can talk about body composition later. I just wanted to kind of hear what you're seeing in patients and how that shows up in a session, because I know from my history in working with patients who've had bariatric surgery, there's a lot to unpack around how they feel about being weighed, being in a clinic where weight is the primary number that they have as an objective sense of how they're doing. There's lots in language around success and failure. So with that sort of big, wide open area, maybe you can respond to that and see where we can go with that.
Yeah, I think what's challenging about the scale and really about like anything where we're being associated with a number and that number meaning we're good or bad, we're right or wrong, we're like okay or we're broken is a challenge. And I think everyone has a story, like some kind of core memory, either from childhood or later, of like, you know, being assigned a number and your doctor being like, well, that's bad. Being, given the biggest t-shirt size and like that being bad. And we get these beliefs in our mind that like, if I'm this number means that I'm not worthy or that I'm not doing a good job or whatever it is. Or like it could be the opposite, like maybe being told like, oh, you're the lightest cheerleader on the team, you get to go to the top of the whatever that thing is called, the pyramid. So you're good. So either way, we like associate these things with goodness and badness, which is, kind of like a child mind thing to do. But we know as grown resourced adults that that's not true, that we are good and we are worthy regardless of our size. But I think those associations are so deep, and because it's, there's still, your doctor has the range that they want your blood pressure to be in, and there is still these connections between good and bad with numbers that follow us into adulthood. So it just can be loaded, kind of like
Yeah.
you're saying. But I think it's also kind of it's an interesting entry point into like starting to unpack what are those stories and what are those beliefs, and what are those emotions that are kind of like underneath, so that we can get to the stories that are actually causing the harm. Because it's probably not actually, I mean, it might be, but like it's probably not actually that your doctor is taking your weight because they need to like track a thing, but it's like the association that you have with that. So how can we kind of like look below the surface and untangle those two things? And like easier said than done. That's a challenge, but it is a rich area to explore.
Yeah, I mean, and that gets reinforced so many different times during almost every day. But I was going to ask, how do you, when you're first establishing a relationship with someone about this, what are some of the ways that you ask those questions or dive in to get that? Because there's a lot of providers who, in my opinion, do a strange job maybe with talking about weight, how to, even just asking permission to talk about that, permission to weigh someone, permission to get someone's body composition done. I think these are all things that we want to be able to help give some experienced recommendations on how to do that best, to not cause harm, and to have it be, when you need objective data, let's get that done, and doing that in a way that jives with the patient.
Yeah. I mean, I like for my work, I don't ask what someone weighs or like what they want to weigh or really about that. I ask about their health goals. But people will come, often people come in and they're like, I want to lose 50 pounds. And that's great. It's your body, your life. You're allowed to have whatever health goals you want to have. But I think it's important for the conversation not to stop there. Like to me, that's the door we're going to walk through. So, okay, great. You have this goal to lose 50 pounds. Like what makes you want to have that goal? What do you think is going to be possible for you when you are 50 pounds later? Have you ever been 50 pounds later before? Like, what was that like? And if we kind of pull at the thread of the number, we usually can find that it's connected to some kind of deeper desire about like how they want to live or who they want to be. And that's like, to me, that's like where the action is. And that's the thing that's really trying to emerge. Like,
Beautiful.
it's not really that they want to be I mean, sure, we all want to be in a smaller body, but it's really like the life that they want to live and the person that they want to be that is the more magnetic goal.
Oh, I love that. Yeah, pulling at that thread is really what that's all about, and yeah, and at the same time, being patient centered means exactly what you said. Saying, okay, I hear you. That's your goal. We're not going to say that's not a good goal to have. We can explore that, and I think that's a really good way to sort of start that relationship and conversation. And another kind of thing that comes up a lot, I think people have experience hearing something is good or not good. People come and say, I heard you're supposed to weigh every day, right? Or, is this associated with long-term success in a weight management program? And, there is research, I think there's some research all around that topic that's interesting. So does that ever come up when people ask you, well, how often should I be doing this? And what, I mean, people put you in that kind of question all the time, right? Is this good? What should I do? Right. And then you use your skill set to navigate around that conversation.
Yeah, definitely. I think, I mean, again, I'm going to be a broken record. I would get curious about it. Like, what, if you want to weigh yourself every day, like, what makes you say that? What are you hoping the scale will tell you? If you've been doing that, like, how's it going? Like, are you stepping on the scale and then you're in a really bad mood for the rest of the day? Or are you, is it supportive to you? So I feel like I would get really curious about kind of like, what are you hoping that the scale is going to tell you? And I won't tell them what to think or what to believe, but I'm generally not a weigh yourself every day proponent. Because I think we think the scale can tell us things that the scale can't actually tell us. And, so if someone is really like dead set on weighing themselves every day and we're seeing that it's having a negative impact on their, stress levels, their mood, their emotions, their relationships, whatever, we can experiment with like putting it away. Also, like what happens if you take 2 weeks off from weighing yourself? Like, what do you notice about how you're able to show up in that? And just kind of, it's, less about telling people what to think and more about helping them collect the data and really tune in to the wisdom that they have about what's actually serving them.
I love that. As a dietitian, for me, a lot of the next things that would come out when people talk to me about that would be, oh, well, I weighed this morning, it was up, it must have been, insert whatever food they had for dinner or for breakfast, and then making, like you said, daily decisions about what they're going to do next based on that information. And so that feels pretty damaging for a lot of people, and for some people, and as I say that, I had people, I always joked it was like my male accountants who, like, that daily habit worked for them. They did it. It helped them stay in check. It helped them feel like they had some parameters that they were checking, because, like, they're a data objective numbers person. And obviously that's a big generalization, but I did have a subset of patients who, for everyone who I wanted to say, hey, we're getting too obsessed with the numbers and focus, there'd be people who it was neutral information to them.
Yeah.
And I think that's maybe part of what you can help figure out by the rest of what they're saying is, does this data feel like data, or is it data plus emotional baggage?
Yeah. Yeah. And also, like, how much power and energy do you want to give to the scale? Like, do you want to be thinking about how every food you eat is like impacting your body all day long? Like, is that how you want to spend your mental energy? And maybe you do, if like you're a numbers person and you like to like see, I don't know, maybe that is interesting to you, but maybe that's actually kind of not how you want to spend your time.
Yeah. And that gets too to kind of intrinsic and extrinsic, or internal and external motivation. And I know that's a big focus for counseling. And as we're talking to folks about, what are the things that motivate you? And I mean, I'm sure a lot of times the first thing people say, hey, we're in a weight management clinic or an obesity care, program. I'm motivated by that number. And I would say pounds, or, sometimes even the body composition parameters can feel like external things that someone else put upon you, like, and this is, for me, this is a big area of interest. I did my dissertation on self-determination theory, and what these numbers meant. I found that the people who were most intrinsically motivated did best longer term after they had bariatric surgery, because they were able to stay connected to that longer term. Once the group of patients who lost weight met their goal, someone else's goal, or some other extrinsically motivated number, it was hard for them to stay motivated, because that was like a stay the same goal, which is not inherently motivating. So it's kind of interesting just thinking about, what these numbers are. And I, of course, love the idea of curiosity leading. And I know that, in my experience, that worked really well with most patients.
Yeah.
Not everybody. Some do really come wanting you to tell them what to do.
Yeah. Yeah. And I think that's like a little bit of this too is about being able to kind of hold two things at once. So like, can we have these goals around numbers? Because people, like, as you know, they don't want to let go of that goal. And so that's okay. Like, we can hold on to that goal around numbers. And can we still work on like how you feel, how you're able to like pursue the things in your life that you want to pursue, while we're kind of holding on to this number? Because the other thing that I find, and I don't know that I can totally explain it, but there is, like, when we're able to take some of the focus off of the food and the number and put it on like pursuing the kind of life that we want to have, having the kinds of relationships that we want to have, it just kind of takes some of the stress and the, like, I don't know, like hyperfixation off of what we're eating and how we're moving, and allows a more like natural, sustainable, and also like healthy, balanced experience with food to kind of emerge when we're not like, kind of trying to strangle ourselves into having the perfect diet. So there's some kind of magic, I think, to kind of like focusing our energy where it really needs to be on, building and leading the kind of life we want to have, as opposed to like trying to force our body to be a certain shape. Like, but they work together in a magic way, I think.
I totally agree with that. And I've seen that so many times where, I think the way I've always thought about it is sort of figuring out someone's core values, because those feel personal to the patient, and they don't feel as much of, I should be this, I should do this. It's like, here's who I am, and here's what I like, and what my life looks like. And I love the way you say, what do you want your future life to be like. That's a motivating way to sort of get to health goals, I think, in a roundabout way. Um, but I think people can understand that that is personal. Whereas in the health, nutrition, wellness realm, I think a lot of it comes down to, well, this is the way I was told was the best way to eat. Like you've said a few times, the perfect diet, right? In air quotes, of course, like that's some sort of ideal that we're hoping to get to. And then when you don't get there, because we never all will, and nor should we, how do you feel about that? And that brings up a lot of the should conversation, right? Of like, oh, I heard I should do this. And I always love saying, we don't want to be shoulding all over yourself, right? And
Yeah.
people usually laugh at that, but then realize, oh yeah, actually everything I am saying is I should do this, I should do this. I think that's your actual most simple telltale sign that you're pursuing an external goal or an extrinsically motivated path versus something that you want to do, you know?
Yeah. Yeah.
So I love how this, we talked a little bit before about kind of the evolution in my role here, but I did not think being at a company that makes body composition equipment, I'd be able to have so many of these sort of psychologically rich conversations, but it is so intertwined,
Yeah.
and I know for me, being able to offer patients, and specifically in my experience in the obesity care space, but really at any level, primary care or anywhere patients come through, being able to offer other metrics other than one singular metric, right? So, we talked a little bit about what different things we can offer with body composition. Is someone pursuing reducing their fat mass? Are they pursuing, increasing or keeping their muscle mass stable as they age? Are they looking at water or phase angle or, some of these other more complex factors? And it's like, I think when you have a few different things to focus on, you're able to see a more rich and full picture than just a singular metric. But I'd love to hear your thoughts on, how do you see body composition assessment fitting into this space?
Yeah. I mean, it's so interesting. There's just like a million, as the technology advances, there's kind of all these metrics now available to us. I still think the ones that I am most curious about for myself and for my clients is like, how are you sleeping? How are your stress levels? Like, are you able to be present during the day? How's your mood? So those kind of like the original ones are, I think, where I put the most emphasis because I think those are the ones that are kind of impacting our day-to-day life and help us to um, be able to function well in our lives and kind of do what we want to do. So that's where I would put the emphasis on. Um, but we do, we live in this world where there's all these other things that are available to us, and I think that can be, people can explore with that. But I would be really curious too about like what are your health goals, and like what's the reason for kind of pursuing, either body composition or like people are doing continuous glucose monitors even if they don't have diabetes, and like there's just all these things. And I think it's important to be mindful that you know the body composition stuff exists for like doctors, and then there's people who are trying to live to be 140, so they have all this like new technology that they're tracking all these metrics because they want to live to 140. And just because other people are doing that because they have different reasons for getting those numbers, like, does that apply to you? Do you want it applied to you? Like, if you're just trying to like live to a normal age and have a healthy life, like, do you actually need all these tools that other people have? And maybe you do, but I would think just because other people are doing it, maybe it doesn't mean that it's what's best for your scenario.
Yeah, I've seen, I didn't watch it, but I saw there's, some sort of documentary on Netflix that looks like, this guy who's really pursuing
Yes.
longevity in that way and is spending hours and hours a day. And so, my take home from that is usually is the life that you're living now worth it? And are you, the enjoyment piece, I think, is always one that I like to focus on. Where I do see that kind of overlapping is when I hear people say, I want to, be doing this at 85, or I want to be able to, for me, it was always, I want to get down on the floor and play with my grandkids and be able to get up. That was such an important one for so many of my patients. I'm able to say, well, how are we, pursuing that? What type of things are we doing to be able to achieve that type of a goal? And that's where I've seen, in particular, the assessment of muscle mass and lean soft tissue and fat-free mass, as parameters, to be able to look at those and say, here's how I can tell I'm moving in that direction, and moving in a direction of like being able to be strong. And I think that's a really worthy goal to pursue, and a way that we can sort of assess it with something that's objective. Of course, there's more, ways to assess muscle function and, other things that we can do that aren't, body composition, from a scale type perspective. But I've been able to see that be really helpful in helping people move towards their goals, in particular when they're pursuing weight loss, right? Because that tends to be, there's so much now around, and I know that, your patient population is, a lot of patients who are pursuing weight loss, whether it be surgery or medication. And, if that's their only focus, what do they do when they get to a stable weight? And we're talking about maintenance. And this comes up a lot. Like, staying the same status quo is a really boring and not motivational goal to keep you moving forward.
Yeah. Yeah. And I think it's also like, I'm going to again sound like a broken record, but if you're in a maintenance stage, like maybe then the challenge isn't to be focusing so much of your time and your energy on, your health and your metrics. Maybe it's to, like, if you want to be on the ground with your grandkids, maybe it's like getting down on the ground with your grandkids, like actually doing the thing, or like, gardening, but really like focusing, I don't know, more on living and less on kind of like preparing your body to live.
That's a good way to put it. I like that a lot. Yeah, another piece, we could kind of go down the road of some of the longevity stuff that's been interesting to see how that's evolved, and all the, medical tests that people are getting done. And there is kind of this focus on data and objective numbers. But even that home assessment, as you've said, measuring body composition in a doctor's office is one thing, but people really have been talking a lot about doing this at home. They have a scale. We don't need to talk about accuracy and if that's the best way to do it, but just from a purely data driven perspective, is getting on a body composition scale, and looking at those numbers daily, in my opinion, it's not as helpful, because it's not really assessing change over time. And that's what we want body composition to do, is really help you see, like, hey, I'm experimenting, I'm trying a new way of eating, moving, doing my life. And like maybe in a month or two, we can kind of see, is that moving in the direction that we want? I think that's really helpful. What I see is maybe more harmful is getting on there daily, doing that same thing that people did with weight and the fluctuations in water, with other more complex data points, without one of us there to help them understand and interpret it, right?
Yeah. Yeah, I totally agree. I mean, even you just like saying that makes me feel stress in my body. So for me, I'm definitely not getting on a body comp every single day. And I think like that's how I would think about it, because stress is so important to health. It's, if you want to lose weight, stress is not your friend. So I would take, feelings of stress really seriously. And I think if getting on the scale is stressing you out every single day, it's not a good tool. But if it's not, then maybe there's more room to kind of play around with kind of getting really into the numbers. But yeah. I don't know, something about like your body being also like a hobby isn't sitting well with me. So I'd want to explore that more. But it's very interesting.
That's an interesting way to put it. Yeah. And I mean, another piece of this that I actually did have some conversations last week with some folks around um, is kind of the controllability of body weight and size and composition. For a lot of folks who have been in a larger body for most of their lives and are experiencing change to that with medication or surgery or whatever means they have, during that time they've expressed like they like seeing that number go down, right? If it's talking about weight or body fat, right, they like seeing that, and it feels like it's reinforcing something that they're doing.
Yeah.
And I think that that's, I'm guessing you might agree that that's kind of a slippery slope.
Yeah, I mean, I would, everyone's different, but I would guess some of the reason we like, of course we like seeing that number go down. We live in a culture that equates thinness with goodness, and so we've been trained to believe that from the beginning. So it's not surprising, and it's okay that people feel that way, but we can't get away from, like, the truth is that you are worthy and good and beautiful at any size. That is the truth, and we need people to believe that. And of course, that's easier said than done. But yeah, it is a slippery slope, because you have to be able to kind of like love yourself and love your client no matter what weight they are, which is really hard in the world that we live in.
Yeah, and I think pursuing, this is there's been a lot of talk over time, and I think we should also give a nod to Robin's book, kind of talking about this topic, where she's talking about health at every size and sort of the traditional obesity care, comprehensive care approach, and maybe those two sides aren't necessarily at odds. But I think it's an interesting thought, because I've been with a lot of patients who are in much larger bodies than they're comfortable in. They're pursuing health goals, but to pursue that health goal, they need biological assistance from a medication to get there, and that's helping them pursue their very connected and worthy goal of improving their health. So how do you do that without making it too focused on the metrics that everybody's sort of drawn to because of our culture, as you said?
Yeah, I think it's, again, like, kind of talking like values and really connecting, like, why are you doing this? Um, and making sure that we check in on not only how is the scale going, and honestly, like, I'm not focused on that, but like, how are you feeling? Are you in, like, are you feeling better in your body? What's that like? Like, what are you kind of doing now that's different? And kind of like making sure that people are really enjoying, um, and embodying in this new experience, so that they can really, like, it's like enjoying your food, like being able to get all the juicy goodness out of all the hard work that they've done.
Yeah.
So I think it's like that constant reminder that you have to, like, kind of put your focus back on what really matters.
Yeah, I have seen a lot of that discussion, even around food noise, that people are experiencing reduction in that. They're able to maybe do the things they always thought they wanted to do from a food or movement perspective, and not have to think about it so much. So it actually, I do think we should be assessing enjoyment of life or whatever that may be in the process, right? Because to me, that's a huge goal. And I think we should be thinking about that in determining, I don't love any use of success or failure as terms, but, if someone's doing well from a life enjoyment perspective and their weight's not really changing, I still think there's an argument for that biological agent to stay around to help them there, even though translating that to insurance is and coverage and access, of course, is probably way too much for us to think about.
Yeah, for sure. I mean, I think, yeah, I mean, the whole health at every size, that theory that, like, we don't really know exactly what any one person is supposed to weigh. Like, I think there's a ton of truth to that. There's some things that we just kind of have to trust Mother Nature and trust our body, and maybe Mother Nature knows better than we do. So obviously, we don't want to, like, throw out everything we know about science and stuff, but yeah, we don't know everything.
Yeah. Well, this has been a fun conversation for me to get, kind of deep into this with you, and reinforcing for a lot of the things that I used to do with my clients and help our customers do with theirs. So it's a really nice way to combine some of the evidence-based approaches with, this other evidence-based counseling approach that I wish more people were practicing. So I really appreciate you coming on and talking to me about that. Anything you want to leave us with? I think I've got some nuggets already: the curiosity approach, the really sort of checking in with your life and enjoyment things, sleep, stress, not so much the objective numbers that we tend to over focus on. But yeah, any last thoughts, and then how to stay in touch with you?
Yeah. I mean, I think my last thought is just, the most cliche of them all, that, you are worthy, and your clients and patients are worthy, um, and, belong and have something to contribute to this world at any size. Um, and it's cheesy because it's true. And I think we have to like do whatever we can to remember that as often as possible. Yeah, so I will leave with you with that. Thank you so much for this. Robin said you were going to be easy to talk to, and she was right. So
Oh, good. And Health Psychology Partners, that's what's the best way to stay in touch with your team there?
yeah, so we are available at healthpsychologypartners.com. And then I am on Instagram at Anna Gordon Coaching. And I also publish on Substack. My Substack is called Eating with Insight.
Okay.
You
Well, I'll
can
have to
follow
follow
along.
you on there. Yeah,
Yeah.
absolutely. Well, thank you so much for this conversation, and hopefully we'll get to meet and connect in person one of these days soon.
Yeah. Thank you.
All right. Take care.